Hi, my name is Kristin McGarry, and I'm currently enrolled in the Rural Family Nurse Practitioner program at Eastern Kentucky University. In this presentation, I will discuss the findings for my Integrative review for NSC 890. The anti-vaccination movement is a growing trend across the United States. Vaccinations protect people of all ages from many preventable diseases. However, with the rise of anti-vaccination, many of these preventable diseases are on the rise again. Some reasons for anti-vaccination include lack of education, religious or philosophical beliefs. Whatever the reasoning is, it is obvious that anti-vaccination is a growing threat to public health and well-being. The World Health Organization named anti-vaccination as one of the top threats to public health in 2019. The Office of Disease Prevention and Health Promotion, Healthy People 2020, found that only 68.4% of children aged 19 to 35 months received the recommended doses of necessary vaccinations in 2012. The goal of Healthy People 2020 is to increase vaccination compliance to 80% by 2020. Increased vaccination compliance will cause a decrease in preventable diseases, resulting in a positive impact on public health. In the literature review, I searched for research to answer my PCOT question. In pediatric patients, how does parental reminders and education compared to standard care increase vaccination compliance within 1 year? The first article I reviewed was a systematic review and meta-analysis that examined interventions to improve vaccination compliance. The review focused on the amount of MMR, DTaP, Hib, PCV7, and Hep B vaccinations administered. Multiple independent variables were examined, including telephone and postal reminders, door-to-door recall, postnatal health education, vaccination incentives, educational home visits, decision aids, immunization cards, home vaccination, school nurses, and case management. Dependent variables include vaccination schedule compliance, the number of children completely immunized, on-time immunizations, and immunization rates. This review found that education combined with postal reminders resulted in a 16% increase in vaccination compliance. The review also found that discussion-based interventions increased vaccination rates by 12%. Parental education was found to increase rates by 8.3%. The next study I examined was a randomized control trial. Children under the age of 9 are required to receive 2 doses of the influenza vaccine for the first season they are vaccinated. Many children do not receive the needed second dose of the influenza vaccine. The randomized control trial sought out to determine if text message reminders improved influenza vaccination rates. The randomized control trial was conducted in 3 community-based pediatric clinics. These clinics serve primarily the Latino population. Most of the children who attend these clinics are eligible for free vaccinations. Children were included in the study if they were 6 months to 8 years of age, received the first dose of the influenza vaccine at a study site, needed 2 doses of the vaccine that season, and had a cellular phone with texting capabilities. Patients who signed up to participate took the short test of functional health literacy in adults to establish their health literacy. Parents also received $10 compensation for their participation. A total of 662 patients were recruited to participate in this study. Only 2 of those participants were found to be ineligible due to previous vaccination status. The analyst was blinded to individual assignments. Participants chose to receive the text messages in English or Spanish. Participants were assigned to 3 different groups. The usual care group received a written reminder of the next vaccination due date. The conventional reminder group received 3 reminders of the vaccination due date, all on the due date and 2 weeks after the due date. The educational text message group received due date reminders with additional educational information. Parents could also choose to receive interactive messages containing further information about the vaccinations. Primary measurements included receipt of second influenza dose by the end of season and timely vaccinations. All the messages had a 3rd grade level readability. Children in the educational text message were found to be more likely to receive the second dose of the influenza vaccine compared to the conventional and usual care groups. 15% of those in the educational text message groups requested more information about the vaccine. One identified risk of this study is that a child could possibly receive the influenza vaccine too early. But overall, this study found that parents who received text messages reminders were more likely to get the second dose of vaccination for their children. The third test I reviewed was a qualitative study. Research has been performed to test the effectiveness of parental reminders in increasing vaccination rates, but minimal studies have addressed parental preference in receiving these reminders. This qualitative review performed focus groups and individual interviews to determine the readiness to receive text message reminders for required immunizations. Interviews were performed in Spanish and English. Participants were recruited in waiting rooms of 5 different clinics in New York City. Participants were included in the study if they had one child aged 10 to 19 years of age and if they had a cell phone. Participants received a $25 check card for participation. The interviews focused on barriers to immunization and preferences for text message immunization reminders. Sample text messages were sent to participants during the study. Content analysis was performed and transcripts were coded. These codes were further evaluated by other members of the team. There were a total of 28 participants in this study. Participants identified barriers to timely immunization, such as busy work schedules and unfamiliarity with vaccination schedules. Many participants in the study said that they were interested in receiving text message reminders. Participants suggested that reminders remain short and personalized. Barriers to text message reminders included cost and difficulty of operating a cell phone. Most of the participants in the study were able to open and understand the text message. Overall, it was found that text message reminders would be well accepted in diverse populations. The advanced practice nurse must advocate for the well-being of their patients and community. The findings from this review suggest that parental education and reminders will be an effective intervention to increase vaccination compliance. Improved vaccination compliance would lead to decreased illness, which would allow the patient to achieve well-being. The intervention I propose is implementation of parental reminders and education for needed vaccinations. An advanced practice nurse could implement these interventions in a pediatric primary care setting. The advanced practice nurse could identify the vaccination with the lowest compliance and focus education and reminders on that vaccination. Reminders could be sent via mail or text message. Reminders should include education on the importance of vaccination. Parental reminders and education are a simple intervention that would have a positive outcome on the health and well-being of patients. Thank you.